We can't be timid in transforming our health system. We need to usher in a bold new era grounded in health for all. We need new visions, new metrics, new institutions, new stories, new heroes. I'm Dr. Chad Swanson. I'm on a journey to understand and transform our health system, and this is my daily health systems transformation video. We need a new vision. In the last 150 years, the vision was science, connecting science to medicine for elite professionals to treat and increase their status. Today, and working for the future, we need a vision of health and well-being for all at the lowest cost to the system. We have valued over the last 150 years episodes of treatment, elitism for professionals and those that gain financial reward from the system, and universities and other organizations that focus on scientific discoveries and profits. We need a system that values health, equity, and efficiency of the system. Our system has been based and grounded on a paradigm of biomedical reductionism. The idea that we can break down the body into separate parts and analyze those and treat those, or the system in separate parts and analyze and treat those, focusing on the medical treatment and biology of those systems. We need to transition to a complex social systems perspective, a perspective that is adaptive, that considers the interaction between parts, that considers how people and organizations and the systems within our body change over time. We need new metrics and new incentives. We have been measuring volume and profits and grants and degrees and short-term metrics and projects, and we have been financially and otherwise incentivizing those things. We need to measure health for all and then incentivize for health for all. And we need to incentivize those organizations or institutions that can achieve health for all at the lowest possible cost so that there can be innovation around efficiency. The stories and the heroes, the stories that we've told ourselves and the heroes in those stories need to be added upon. So there have been some miraculous stories around Johns Hopkins and the Mayo Clinic, professors in universities, researchers in discoveries, and CEOs in corporations. We need to add on to those and change those so that all who improve health in communities are held up as heroes and champions and given power. I'm aware of some of the work that the Robert Wood Johnson Foundation and the Ripple Foundation are doing around this idea. I know many are as well, but we need a societal shift. We need new institutions to transform our health system. We have held up institutions such as universities, hospitals, research institutions, which has carried a tremendous amount, which has brought with it a tremendous amount of advancement in biomedical science. But we also need community-based institutions and organizations. We need coalitions and collective impact organizations that work across boundaries to improve the health of communities, not just focus on biomedical discoveries and volume of patients treated. We need these community organizations to be adaptive so that they can innovate to best meet the needs of communities. We need new funders. The Rockefeller Foundation and Carnegie Foundation and many others in the late 1800s and early 1900s financially backed hospitals and organizations such as Johns Hopkins, such as the Rockefeller Institution, many, many others. We need funders today who can usher in a new era of health and well-being for all. We need new financial arrangements. So today, financial groups and organizations, whether it be in pharmaceuticals or private equity or hospital corporations or pharmacy organizations, are innovating around to exploit the existing system that is incredibly flawed. We need financial arrangements that are better aligned with what we really want so that we innovate to transform around health and efficiency. We need other incentives as well, not just financial incentives, to align with what we really want. And then we need policies. We have passed and lived with policies that are largely patchwork and fragmented and focused on insurance coverage and treatment. We need policies that encourage innovation and self-organization around health for all at the lowest possible cost. All of these changes will result in a change in the culture. So in the late 1800s and early 1900s, there was a phenomenal shift in our health system and medical system and university system around medical treatment and discovery. There were many advantages to that. There were many disadvantages to that, as many were left out, and the social aspect of health was set aside as well. But that culture changed in elite institutions like Johns Hopkins, and then gradually over time it changed, and that culture was then felt in communities as well. We today need a similar shift in culture, grounded in health for all at the lowest possible cost throughout the country. These are my rough, unpolished ideas. I'd love your feedback, criticism. These daily videos are meant to be an informal conversation, so I'm happy to clarify or correct. I appreciate your feedback and engagement. Thank you.